always seems a bit daft to me not to treat people in prison to the max, because these are high-risk individuals. They're the individuals who will go on to have liver failure and liver cancer and all the rest of it. It's a never-ending story, which incidentally is why I work here, because if you want to see clinical medicine, there's nowhere else like a prison for the diversity of what you see.
I think one of the benefits of people being in prison, and I do say this, I love a captive audience, that they can't get away, and so we run a very good program, very good vaccination program, and so as I said again, we get the herd immunity.
I think with any of these viruses, what I find really important is that that you work with somebody. I think doing you shouldn't drink alcohol or you shouldn't do this is actually sort of defeats the purpose. I think health professionals really need to be mindful that as soon as you say don't do something, that people find that really difficult.
The hepatitis B is just ways to protect yourself, how transmissions happen so easily and through ridiculous things. One of the issues I didn't know was don't touch injection sites, like it's just so common. But it's never mentioned. All the tools are mentioned and the blood crosses are mentioned. But you pull a needle out of somebody's arm, you put your thumb on it straight away. Everybody seems to do it. It's just stupid when you think about it. But I didn't ever think of it before.
So the process when people come into jail, they are offered what we call an admission screen. So that's pathology, and within that admission screen is a Hep B, Hep C screening. So when the results come back, the medical officer, Chris Wake, then refers to one of us immunisers. There are 3 of us currently here, and we are responsible for booking and overseeing the hepatitis B vaccinations.
Hepatitis, both in Australia and in the prison system, appears to be on the increase. We're certainly diagnosing more of it. We recognise nowadays that there are probably about 200,000 Australians living with chronic hepatitis B. In the prison system, the risk groups that we tend to see are people in the immigrant population and their children in the second generation, men who have sex with men, people who inject drugs, people who have multiple sexual partners. Basically, in the prison system, hepatitis B tends to be a facet of the lifestyle of young men who perhaps have a bit of an irregular lifestyle, if you could say in general terms. It's interesting that the last National Prison Entrance Bloodborne Virus Survey showed that only 40% of prisoners who tell you that they've been immunised for hepatitis B are actually immune. That's very low, isn't it? So these are people who say, yes, I've had my 3 injections for hepatitis B, but when you actually test them for immunity, only 40% are immune. So clearly, people are not really clear about how many injections they've had, about the spacing time-wise of those injections, or even in many cases what they're having the injections for. So imparting that information is really, really very important.
We have 3 schedules. We have a 21-day schedule, which has to be medically prescribed because it's not in the immunisation schedule. We have a 3-month schedule, which is also a fast track, and we have the regular 6-month schedule. So when the inmates come up to the clinic, we explain what we're doing. We give them an appointment card that I developed, basically so they are then responsible to make sure that they let us know if they don't get to their appointment.
It's difficult to get 3 injections into a person who's in prison, because it involves a cast of thousands. It involves people who prescribe, people who administer, it involves prison officers who have to bring the person to have the injection. It involves prisoners getting out of bed when they might not want to. It literally involves a cast of thousands. So what we've found is that you have to make sure that the cast of thousands understands what's going on, and most importantly, the person who's having the immunisations.
So today we're going to give you your hepatitis B vaccination. Okay. It's a series of 3 injections. Which will give you the 3 dates. So today we're doing the first one. So you're being vaccinated under an accelerated schedule. All right. So that's your second date, that's your third date. And because you're being accelerated, you need to have another vaccination within 4 to 12 months. So the impact of the hepatitis B vaccination program within a correctional setting gives us a herd immunity of over 70%. So then that protects the unvaccinated people. But certainly over the years here, more and more inmates want to be vaccinated. They hear from other people. Now that we're able to do the fast track here, we capture a lot more of the population.
The rates that we see, about 25% of the people coming into the prison have had wild hepatitis B. They've had hepatitis B, and we know that because they have a core antibody positivity, which is the marker of the natural infection. So that indicates that there is a significant rate of hepatitis B happening in Tasmania, which we probably don't know about, because the first time we find out about it is when we test these people. And we're talking about 500 individuals coming into the prison who are testing positive for wild hepatitis B. In terms of acute hepatitis B, we don't see a great deal of that in the prison, about 2 cases a year. So this is diagnosed in the early stage of disease, typically in the first weeks and months. Almost invariably that is associated with intravenous drug use within the prison.
I'm an intravenous drug user, have been for a lot of years. I have no bloodborne diseases, but I have a big interest in bloodborne diseases. I need to be able to protect myself and the people around me from such incidents. I've been an intravenous drug user since the early 1980s. When I started, chemist shops always used to have 10 packs of new syringes. They were always so easy to get, $6 like they were charging for 10 brand new needles with a black box. It was very easy to get, and I always went and got some. Always nice to have one buried somewhere that you can go and dig up if you need to. And I never really shared. I never got into a group situation where we were 6 of us, and if we did, we were always new. Just makes everything work. AIDS was very pushy on the TV. There was a lot of ad campaigns happening around that issue at that time. So, and it was one of the things that worried people. But like I said, there's still things I don't know, like don't touch the injection sites. Like, still little bits of knowledge you pick up along the way.
Okay, so thanks for coming along again this afternoon, guys. So last week we did hepatitis C, and today we're going to cover hepatitis B. So I'm not quite sure how much any of you know about hepatitis B, but I thought we'd do a bit of a brainstorm and see what you already know. So I educate all of the correctional officers around bloodborne viruses in relation to standard precautions and infection control. Assist with workforce development in terms of our nursing staff, work with the clinical director around coordinating the hepatitis C treatment program, and do various types of education with inmates. So that's education prior to hepatitis C treatment, for example, but it also runs specialist type education programs around bloodborne viruses and health literacy. who else do you think there? That's right, Aboriginal and Torres Strait Islander communities is certainly one of the at-risk groups.
Drug users, tattoos.
So people who are injecting drug users. What other major group of people? Not thinking not just about the actual.
Sexual, I suppose.
Gay.
Yeah, so no, they're not. So what we'd be looking at is migrant and immigrant communities are particularly at risk. Correctional Primary Health formed partnership with the Prison Education and Training Unit, and one of their peer tutor coordinators, when she's been working with some inmates, identified the need to address some of these health issues which are ongoing within the prison in a health literacy type of way. So recognising that she works with peer tutors at a certain level and that they can then reinterpret health messages for people with much lower literacy. We know that about 30% of people living with chronic hepatitis B are actually undiagnosed, so they don't have it. And of course, if you don't know that you have something, it's really hard to prevent transmission and or maintain your health and get the proper health checks and things that you would need. So far the evaluation's been really good. I think they probably get just as frustrated as what we do in a sense of some of the barriers when you're working within a prison to the provision of healthcare. Increase the risk. These guys have nominated to do it. They do it in their own time. They're not paid to do it. And generally I think it's really well accepted. A lot of them want to do it because they've got young people in their lives that they want to provide really good health information to and keep them safe.
Yes, I don't think that's any risk because normally before you get the utensils you'd like to think they'd been washed.
Yeah, absolutely. So
I had my Hep B shots late 90s, so I've sort of been immune to it, and I don't get into using drugs intravenously. I don't get backyard tattoos, so I've never really worried too much about it. But given the prison environment, you've got to be careful of all that sort of stuff. Any bloodborne virus, especially in prison. But one thing within the prison, everyone's always been scared of a blood spill. But unless you're going to roll around in it and blood means nothing. You've just got to treat it with respect and not worry too much about it. So I've learned lots about different aspects that can help me within the prison to stay away and stay clean.
if I leave at the end of the day knowing that I've provided information that's been understood, then that's a good day for me. I think you have to take small wins when you work in such a complex environment.
We know in Tasmania that we have about 6,000 people who have bloodborne virus positivity. Yeah? We know from federal numbers that about 5,000 are either injecting or have injected. The number we actually treat for drug and alcohol problems in the community is measured in hundreds. So there is a disconnect of many thousands. Those are the people who keep coming into this prison every year. 80% of them, that's 80% of 2,000, come through this prison every year. So really, until we alter the systems that we use to both treat, screen and organise, well, we're not actually doing a very good job. Again, it comes down to resources, you know. What are we going to treat? Are we going to treat diabetes? Are we going to treat heart disease? Are we going to treat bloodborne viruses? That's why vaccination is so important. It really is one of the most significant public health interventions that we can make.